This semester, I've chosen to focus my learning plan on the role of a nurse practitioner in a neurosurgical setting. But what exactly is a nurse practitioner? Nurse practitioners, or NPs, are advanced practice nurses who work in a variety of settings to provide patient care. Unlike registered nurses, who are part of the general class of the CNO, NPs are part of the extended class, which widens their scope of practice and allows for more autonomy. Like a physician, NPs have the ability to diagnose, prescribe medications, perform procedures, and order diagnostic tests. Examples of these include X-rays, CT scans, and ultrasounds. NPs can set bones and prescribe most medications. In Ontario, they also have the ability to administer medical assistance in dying, or MAID. Nurse practitioners are responsible for creating their own practice, which means that their role is different depending on their place of work and the patient population. NPs can work in one of three areas: primary health care, adult care, or pediatric care. This means that NPs can choose to work in community settings, such as at doctor's offices or in hospitals on wards like 7 West. On a neurosurgical unit, a typical day for an NP involves rounding on patients, diagnosing, treating, and collaborating with members of a healthcare team to manage patient care. NPs collaborate with many professionals, including RNs, pharmacists, and physicians, like intensivists. To work in a neurosurgical unit, NPs must have thorough understanding of neurological conditions and neurosurgical treatments. Additionally, they must have exceptional clinical reasoning, communication, and time management skills. To become an NP, you first need license and experience as an RN. After this, you can complete a master's degree at a university recognized by the College of Nurses. A degree can last anywhere from 2 to 4 years, depending on if you choose to take full or part-time studies. After completing the program, you can apply for a nurse practitioner license and write the exam to become a registered practitioner with the CNO. NPs must also write a jurisprudence exam, which evaluates understanding of the regulations that govern the nursing profession in Ontario. To work on a neurosurgical unit, no extra certification is required, but since NPs create their own practice, they take it upon themselves to complete training that allows them to excel in their work. Examples of this could include critical care certification or workshops on pain management. After talking to an NP on a neuro unit, she gave the following advice to students who are considering becoming NPs in the future. Number 1, know your population. Because there are so many areas that NPs can work, it's important that you find your niche and focus on pursuing that. Number 2, enjoy the ride. It's common to want to move up the ranks quickly, but don't give up valuable experience just because you feel like rushing. Take your time, learn what you can from each job, and move on from there. Number 3, don't do it just for the title. Although being an NP sounds glamorous, it requires a lot of hard work. Be sure you know why you want to be an NP other than the title. Number 4, if you do decide to become an NP, enroll in a full-time program. Part-time courses make it difficult to remember what you learn. Finally, nursing, no matter your certification, is a very rewarding and fulfilling career. Whether it's as an RN or an NP, your practice is what you make of it.